Hello, everyone. Um, have you ever felt overwhelmed by the sheer amount of information you need to process as a physician, as a medical student, as a candidate that's sitting for an exam? Um, were you struggling to balance your work day? Um, the balance that you need to make between patient care, between administrative tasks, and your own learning. This is a known struggle for most physicians in the world, I'm guessing. And you keep on struggling with it most of your career and professional life, and thinking that there is no way that you can improve this. There is no way that I can make it better. This is what it is, and I have to just take it and go with it. No, I don't think that's true. I think there is a way of improving your workload, making your actions more efficient, to give you some form of balance in your life between your professional life and your private life. Okay, that elusive work-life balance that everybody is talking about. So today, that's the topic of discussion. Let's try to organize things and formulate a structure that might be helpful to a lot of you. And here I'm talking about all these young upcoming physicians, medical students, or even in somebody planning to sit for an exam. Because medical exams are basically vignettes and scenarios that are based on real life scenarios. These are patients who are coming to you. And if you looked at these vignettes, actually, you can remember each time you read a vignette, there is a corresponding real life event that happened to you at some point or will happen to you. Okay, so the way you think about these patients in the exam or in real life can be similar. You can actually approach these two problems the same way. Okay? Okay. What I want to introduce you is something called structured thinking. With structured thinking and effective time management, you can not only reduce stress, because this is very stressful. When you feel overwhelmed all the time, that's very stressful. Okay? You can't just day in and day out be overwhelmed and stressed and unable to finish your tasks and unable to finish or complete or catch up with your documentation. This is really not a good way to approach a medical career, because you will get burned out at some point. Okay, and burnout is very prevalent among physicians. Very prevalent. By the way, I have a book about this. I have a book, Burnout Among Healthcare Providers. And I'm focusing on these tools that you can use and utilize during your workday to improve your efficiency, make it more organized and less stressful to you. Okay. In this video, we'll explore how organizing your thinking can transform your practice and help you thrive in your medical career. Hello, I'm Dr. Sarah Ahmed, and welcome to the channel, and welcome to a new video that's intended to help upcoming young providers and physicians and medical students and candidates planning to sit for USMLE Step 3 to go a step forward towards success. Okay, let's, in the beginning, start by understanding excuse me, the challenges. What do we face as physicians? First of all, medicine is inherently complex. We can't take that away. It's complex, it's complicated, it's vast, it's difficult to uh, kind of contain. It's uncontainable. Okay, but you can have some rules to deal with it. You have some tools and rules to deal with it. Okay, that you can, and it will make it much easier for you to practice. We deal with the vast amounts of information, symptoms, diagnoses, treatments, and we have new treatments every day. We have new discoveries every day. And patient histories. Yeah, each of your patients will give you information that you need to deal with as well. It's not about the medical information alone. Your patient, who is a unique individual that's different from the next one, has their own stories and information that will give you, and you need to make sense of that as well. So it's really a lot coming at you, I think. Okay. All this is happening, all this information, all this data are coming at you while working under tight time constraints. There is no way in any medical setting, anywhere in the world, that you will have one problem for one patient that you need to think about. No, never. You always have patients waiting for you, each with their own problems and their own concerns, and waiting in line with very limited time for you to address each of them. So the vast amount of information and the time constraints that you have. Okay, you don't have unlimited amount of time to deal with this. You have very limited time. Okay, add to that the high stress environment. Mistakes in the medical settings are costly, and you are always afraid to make a mistake. Okay, so this is another problem. It's not a stress-free situation or environment. It's a stressful environment. Okay, and it's no surprise that decision making can feel overwhelming. One thing about decision making anywhere, whether it's in a medical field or healthcare setting or outside in real life, the best decision that you can make is usually done when you have adequate information, when you are calm and free of overwhelming emotions and stress and all this. Okay, and when you have time to absorb the information, analyze it, and come up with a decision. This is the best ideal situation to make a decision. Okay, mind clear of stress and emotions, that's ready, no other competing tasks inside, and you have time and you can focus and you have good information. All this, when it's there, then you come up with the best decision you are able to make. But as I told you, we have too much information. Some of it, I assure you, will be corrupt, especially the ones coming at you from the patient. The patients will come and tell you a story. Okay, this story, you are responsible of cleaning it and making it sensible. Okay, they will not come and tell you their symptoms in a clear manner, just like in textbooks. That doesn't happen in medicine. In medicine, you have a story by the patient and their family or any other witnesses. Okay, and it's your responsibility to clean it up and kind of code it into medical terms that you can understand and your colleagues can understand, and then come up or use this information for purposes of making up plans or doing whatever you need to do with. Okay, so the information can be corrupt or inadequate. You are in a stressful environment, being challenged by time limitations, challenged by requests from the staff. You are challenged by your phone going off every few minutes, pressure from higher up wanting you to perform better, whatever, maybe lack of sleep, all this. So this will impact your decision-making ability. Okay? This will impact your decision-making ability, definitely. Okay, so all these challenges affect you and affect your decision making ability, and the decision making and the plan formulation. That's what we do for a living. As physicians, that's what we are supposed to do day in and day out. Make decisions and formulate plans. Okay? Basically, that's what it comes down to. These challenges can affect our cognitive processes, but also affect the quality of care we provide to patients. Okay? You need a clear mind to make up the best plan and to have the best outcome with your patients. That's why I think it's very important. It's vital for us to try to come up with a structured and organized way of thinking and of handling all these competing tasks in a way to, in this limited time, so that we can function better and come up with better decisions and better plans. Structure and organization are very helpful to deal with this mess. Okay? So what do we mean by structured thinking or organization? Let's divide this to deal with these challenges. We need to really focus on two key principles. One, reducing cognitive overload. Okay? And the other one is enhancing critical thinking. When I'm talking about structuring an organization and having a system, okay, in the way you handle your day at work, what I'm trying to do is to kind of empty some space in your mind for decision-making processes to be more sound and better. Okay? And this is what is handled or what's meant by cognitive overload. You don't want to overload your cognitive abilities and cognitive spaces by nonsense. You want to utilize it for the best decision-making capability that you can come up with. And in that manner, we need to manage it. You need to manage it well. All this is stress, too many tasks at the same time, no enough time, corrupt information that you are getting from patients or you are getting from the chart or whatever. All this overwhelms your cognitive processes. You need to manage these cognitive processes from this overload that's attacking it. The other thing is the critical thinking process needs to be sharpened. You need to work on it every time, every day, to sharpen your critical thinking process. Why? Because this is how you plan. That's how you make sense of everything. When you have a very good and sharp critical thinking process, then you are gold. Okay? Okay, so these are the two things that we need to organize or work on. Okay, what do we mean by cognitive overload? Basically, there is a theory called cognitive load theory. Let's talk about it. This theory explains how our brains can only process a limited amount of information at a time. These rumors about multitasking or and I can handle this and this and this at the same time, this is all myth. This is not real. If you want to do something well, you have to focus on that one thing. You can't do multiple things at the same time and expect good results. Okay? And this is all about focus and concentration and paying attention to what you do. And I told you, medical care is complex and it's difficult. Okay? And each patient is unique. Each patient has, maybe you have 10 patients with diabetes, type 2 diabetes. Okay? But each one of them has a different problem related to that diabetes. Okay? So patients, by their constellation of diseases they have, their background history, their social circumstances, their personality makeup, whatever, they form a unique individual. You have to deal with these 10 different unique individuals, okay, on a daily basis. So focus, attention are your resources to harness, to try to deal with this the best you can and utilize it the best you can. Okay. Then how do I reduce the cognitive overload? We can use strategies like breaking tasks into smaller steps, for example, using checklists, focusing on one thing at a time. Don't do multiple things at the same time. This is never good and never helpful, and you will never get good results out of that. Try to teach yourself to focus on one thing at a time, one patient at a time, one problem at a time. That's usually very good. And what I'm trying to say by checklist, for example, instead of having a list in your head occupying part of your cognitive space, take it out, put it in a list in front of you. Checklist. Okay? This is one cognitive task out of your mind. Now you have some space for something else. Okay? And instead of overwhelming yourself by saying, oh, I have to do these 15 patients, take it one patient at a time and you will get done. Think about it one step at a time. Break it down. Don't think big. Think small steps until you are done. Work on it until you are done, finished. Okay? Regarding the critical thinking part, it's a skill, it's a habit actually, and it's essential for diagnosis and treatment. You need to be a good critical thinker to approach medical care in general. People think that thinking and these cognitive abilities and stuff are just for mathematicians and computer geeks. And no, 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 no. As physicians, we have to be very sharp, okay, and very critical about the information we have and the plans we come up with. Especially, this is a high complexity situation, and the mistakes here are very costly. Okay, very costly. You need to remember that. So it's more than just dealing with a computer that can crash. You are dealing with lives of people and health and well-being of people. So critical thinking allows you to analyze information, identify patterns, and make sound decisions. To enhance these skills, practice asking why and how questions during patient encounters and always challenge your assumptions. Okay? Every day. I have been working as an internist for a very long time. I don't want to mention numbers, but a very long time. And every day I'm amazed by something new. It's never boring. It's never the same. Every day you have something new and you know more about medicine. You know more about patients and other people. And it's really very interesting. Once you start thinking about it as I like challenge. Maybe I'm different than most, but uh, these challenges are there every day. And it's really amazing to me. It's really interesting. So make critical thinking a habit. Learn it, read about it, focus on it. It will be a very helpful tool to you in your medical practice. So learn how to harness your cognitive abilities to the max. And this can be found in all these productivity kind of books, how to develop good habits, how to improve your focus, improve your concentration, avoid multitasking, deal with procrastination. All these are things to harness the best cognitive abilities. And the other part, adopt critical thinking as your tool or the skill or the habit that you need to develop. These two things, very important. These are the background tools that you are going to use or processes that you are going to use for structuring and organizing your medical practice. Okay? Or creating a system for yourself. By the way, the things I'm going to talk about are my own. These are things that work for me. Okay, the way I approach my patient encounter works for me. I came up with it and it helps me a lot, and I know what to do every time. I go through certain steps during my patient encounter, and these steps now are part of what I do daily, and they became habitual and automated for me. But each of you can come up with such a system or with some things that you do habitually or automatically. So what works for me might not work for you. I'm just trying to introduce that this you need to think about. You need to think about having a system, okay, in your professional life as a physician. Okay, again, productivity practices that can help you with time management, setting goals for yourself and for your patients. By the way, the plan of care can include setting goals as well. So setting goals using the usual tools of SMART goals or any other goals that can, or any tools that you can help. For example, if you are going to use a SMART goal for yourself in terms of studying, or keeping up with a continuous learning process, you can say to yourself, I will study cardiology this week. This is not a good way. This is not a good way. It never works. What kind of cardiology? Cardiology is a vast. So you say, I will review 10 cardiology cases and summarize key points by Friday. This is more specific. You know what to do, how much work you need to do, and by what time. This is more specific and it fits within the SMART goal tool. So start to sharpen your way of thinking about life and part of your life is the professional life. Whatever you do it in a more efficient way, more efficient, more specific. Make checklists, okay? Make to-do lists. Use SMART goals in whatever small or large project that you have. Use it in your patient encounter when you are talking about goals with your patients. For example, a target A1C. You can put a goal around that with your patient. Okay? Your A1C today is 8.5. I would like it to be around 7.5 by October. Okay? And for that, we'll do 1, 2, 3, and 4. You can prescribe new medicines. You would like him to check his blood sugars. You would like him to lose some weight. You come up with a plan around that goal. That's a goal setting. And people understand this. Okay? So you have a sharp way of dealing with your patient's problems in an efficient and understandable and clear manner. You see, what I'm trying to do here with you today is tell you that these productivity tools, these time management tools, all these hacks that people come up with, they can be used within your medical practice as you are dealing with your patients. Very good way, by the way. Huh? Okay. There are tools that you can use to prioritize tasks. For example, the Eisenhower matrix. This is a 2x2 table or matrix that has four quadrants. Each quadrant defines or identifies the task, either urgent and important, urgent not important, non-urgent and important, non-urgent, non-important. And you put your tasks of the day, of the week, of the months, whatever, along these four quadrants, and you know what to do. Okay, what to do yourself, and now what to delegate, what to do later, what's more important than the others, and what to drop. Okay, the 4 Ds of the Eisenhower matrix: do, delegate, drop, delay. It's a way of remembering what to do with the. Okay, so these are tools that are available in this all around you. You can go into the internet and find all this. And as I said, you have some resources that you can utilize, like your focus and attention, your time, okay, your energy in general, and your all this. These are resources that you need to cherish, you need to grow, and you need to utilize wisely. Yeah? Okay? They are somehow renewable with the exception of time. Of course, time is not renewable, but the others like the attention, the energy, the motivation, all this can be cultivated and renewed. And know these things. Care for your health, care for your do good sleep well, eat well, exercise, get breaks. Don't just work. You have to have breaks to relax your time. Avoid burnout by enjoying what you do. By the way, if you enjoy what you do, you will not feel that it's work and overwhelming and stuff like that. Okay? So continuing to talk about all these things, time management strategies as well are helpful. Organize your day. Usually, I work in a hospital. Okay, I'm a hospitalist. And the way we work is you get your list of patients, between 16 to 20 patients every day, and you get it early in the morning. So you try to manage your day in a way that you can do all the tasks that are required of you in that day, okay, in a reasonable amount of time, in the most efficient manner possible. What are the tasks? Let me give you some examples. Of course, I have to review the charts of these 16 or 17 patients before I go and see them, physically round on them, sit down, talk to them, talk to their families, talk to their loved ones, whoever is involved in their care. I need to attend interdisciplinary rounds. We actually have 2 rounds every weekday with other departments to discuss the patients, their discharge planning, their needs, whatever needs to be discussed. Okay. As part of the rounding process, I have to talk to the patient, to the nurses. I have to talk to the case managers. I have to do a lot of other things. Okay, then I come back and discuss the plan of care, come up with a plan of care actually while I'm doing this. But the final and ultimate way I analyze what I have, what I gathered during all these interactions, I sit down and come up with a plan of care for each of my patients. And this is the decision-making process I'm talking about. And of course, I have to review their lab tests, their radiology tests, any consultations that are there. I need to look at it and see what they think and what to plan for. And the patient needs to be included in all this. You have to update your patients about all this. Because now what we are doing is we have this patient-centered care, which is the best way to approach healthcare, actually. In the past, nobody cared about what the patient thinks. Okay, in the past, 20 years ago or so, people were just making decisions for patients. Physicians making decisions for patients. I will take you to surgery tomorrow at 7:30 a.m. I will cut out your colon. The patient is sitting there and they have to accept that because this is the authority figure. The physician told me to do that. Nowadays, since then, we moved away from that. Now we deal with what's called patient-centered care. The patient is more involved in the decision-making process, but we have more autonomy to be given to them, more respect to their wishes, more engagement with them. And this improves their satisfaction, improves even the outcomes, health outcomes. So you have to update your patients with whatever comes up, any new results, anything, and they need to understand the plan. You need to update them about that. So all this takes time. Okay, you have to talk to 17, 18, 19, or 20 patients every day with all this. Then you come back, you sit down, you come up with the best plan, care plan that you can come up with. And this requires focus, requires critical thinking, requires concentration and energy and a lot of things. Okay? So you have to be able to come up with a structure to manage this. This is a big workload. Okay, so you need to come up with a plan or with a structure or a system to manage this. Okay. Why am I saying that? Because nobody actually is telling medical students that this is what they need to learn, or they need to learn these things uh, to help them with their upcoming professional life. Medical schools are really, really good at teaching you biomedical information, disease processes, pathophysiologies, symptoms, signs, treatments, pharmacology, biochemistry, all this is excellent. But when it comes to the actual practice of medicine, I think medical education is still behind. Okay, you are not fully aware of the magnitude of your upcoming practice until you are in the middle of it and you have to deal with it. It's not all about, yeah, this patient has cough, let's look at the cough, analyze it, and treat him accordingly. It's much more than that. Okay, and now we are starting to realize healthcare doesn't happen in a vacuum. It happens within the community, within the society, with other impactful problems in the lives of these patients. Okay, they are now called social determinants of health. Okay, access to healthcare, access to education, financial constraints, other issues, having support, not having support, being incarcerated, being whatever. All these things impact your health. And it's not just about the cough he has. He has the cough, but his son is battling addiction, and he needs to be his caregiver, and he has financial issues that he can't help him much. And this is his only son, for example. Okay? Definitely, this will impact his health. Yes, you can fix the cough, diagnose pneumonia or asthma or whatever you do. You can give him a couple of pills or inhalers and send him his way, but you didn't fix anything. You didn't really help him. You didn't. He's still having that heartache about his son and his social issues and his financial shortcomings and a lot of things. Okay. Okay. The other things that you need to focus on as a physician and include it in this daily workload that is still related or connected to your professional life is learning. Usually, these science-related professions, they have this revolving door of information, you can say. Okay, a lot of information are coming, new information coming up daily. And we have to catch up, especially if you are using this information in your practice. Okay, I can't be treating people with COPD when I'm lagging behind in the knowledge, the new knowledge that comes up every day. I have to catch up so that I understand what new inhalers are coming, new medications, new guidelines, because the patients will ask, the patients need to know, and I need to treat my patient to the best possible available evidence-based practice. So you need to include ongoing learning as part of your daily workload. Okay? Use whatever method you can. Use audio sites, for example, and instead of reading a magazine, listen to it. Okay? And instead of reading the whole article, not a magazine, the journal, look at it in a visually appealing manner, like a mind map or something like that. So whatever works for you, use it to keep up with the demands of continuous learning. Okay? So whatever tools, technological tools or other more primitive tools that work for you, use them. Okay? There are so many productivity tools that are available online that you can utilize and use them. If you are a technology savvy person, use technology. If you are old fashioned like me, use pen and paper. It doesn't matter. Okay? Or you can use a mixture of both. Whatever works for you, use it. Okay? Okay. Let's move on. Okay, now let me give you the way I think about the patient encounter. There are two phases to the patient encounter. Phase one, when you are interacting with the patient. You can say the face-to-face interaction. I'm talking to them, I'm answering their questions, I'm explaining things, I'm examining the patient, I'm talking to the family. This is a patient interaction. The other phase is when I sit down, okay, and interact with myself now, interact with the information. Okay, as I said, you can or you collect information throughout your workday about that particular patient. What kind of information? Data, information, evidence, whatever you collect it, you are collecting that. At some point, you need to sit down, analyze it, and put it in the correct context. Okay? And then come up with a list of problems or differential diagnoses or whatever you want to call it. And based on this list, you will come up with a plan of care. Okay? Based on this list, you will come up with a plan of care. That's how things work. Phase one, interact with the patient, the family, collect the information that you need. Then you come and sit down and interact with this information, with this data, which can include history, physical examination, laboratory data, the radiology data, other testing that was done, information from the chart about the background history of the patient, and all this together, you come up with a problem list or a differential diagnosis and so on. Of course, you need to be mindful, especially in the exam, by the way. Well, in real life, you know where you are, but be mindful of the setting. Is it the hospital? Is it the emergency room? Is it an outpatient clinic? Is it nursing home? Where are you? The setting can dictate what you do and what kind of planning you do for your patient. Okay? So that's how I think about my patient encounter. I collect information, I talk to them, I interact with them, and I come back and analyze what I have, what I got to come up with a plan. Here, I was just in this phase, you really need to be mindful of so many things. And as I said, stick to the recommendations of patient-centered care. Talk to your patients, listen to your patients, okay? Sit down, give them their time, your attention, and be respectful, be whatever you need to be as a good physician that's really dedicated to their help. Okay. When it comes to analyzing the information, okay, you can analyze it along many dimensions. For example, you can think of the information along their acuity level. how acute these symptoms, how long had been this patient coughing, having cough or chest pain. Okay, is it an acute problem or a chronic ongoing problem, or is it acute on chronic problem, or what is it? Or it's an immediate now problem in front of me that I need to deal with, like in emergency room or wherever acute issues happen. Okay, this is one dimension. The other dimension, you can think about the problems in terms of system, organ system. Is it the respiratory system or the cardiovascular, or is it the GI, or is it the skin, or what it is? What is it? Sorry. Huh? So either along organ system, along acuity level, or along etiology. By the way, in medicine in general, we have maybe 10 possible etiologies for diseases. Infectious, inflammatory, traumatic, toxic, or metabolic. This includes endocrine etiologies, neoplastic, what else? Vascular, degenerative, idiopathic. All these are this etiology thinking or dimension. Okay? Or you can be a very good physician and think about the holistic manner, in a holistic manner. Think about the patient rather than the disease process. Think about the patient with a disease process. Okay, the social aspect of it, the psychological, the financial, the other aspects of make it the holistic view of things. Okay, include these aspects in your thinking about your patient. And then you create the plan of care. And the plan of care, I will dedicate a video for that. This video is about introduction, about how to think about what we do. I know it's a long video, but very important. Okay. And by the way, this way can be applied to real life and the exam. If you have a scenario or a vignette in the exam, you can deal with it the same way. Okay. So this is in general, and remember, patient encounters are the most important events during your work day. Especially, we are internists, we are internal medicine physicians or family medicine physicians. That's what we do: talk to patients and come up with plans to help them. We don't do procedures in general. We don't do procedures or other surgeries or things. These are the surgeons and the other interventional people. For us, it's mostly talking and having and interacting with patients. So we need to perfect this part. Okay? So the two-phase approach to the encounter is good, the helpful way of thinking about it. The tools that you need to improve your workload, okay, and make your workday more efficient, and the patient-centered approach is a very good way of interacting with your patients. And keep practicing, keep learning. Okay? And think of these things as you really need to come up with a system or a structure to deal with this. Without a structure and without good habits, you will get overwhelmed and burned out. And that's a terrible, terrible, tragic outcome. Okay. Actually, I appreciate you reaching this time or sitting throughout this video. I know it's a long video, but I think it's very important. And reduce your cognitive overload and improve your workload day and optimize it. And this will help you a lot to stay longer and be more efficient and love what you do. Okay? Um, so try to implement these productivity tools, time management tools, enhance your critical thinking, enhance or improve your cognitive load, and just work on it. Continue working on it until you come up with a structure that works for you. Okay? Please don't forget to uh, subscribe to this channel, because I'm trying to be more and more active in it and produce more videos that actually speak and talk to young physicians and step 3 candidates. I'm still not in, I didn't do any topics that are related to specific disease conditions, but I'm planning to do that. I will start by a list of conditions that are very common in practice, and I would like people to really be familiar with them. And then I can go ahead and talk about other high yield material for step 3 and high yield material in life, actually. Okay. So please like this video, share it with your colleagues, and check out all the other videos that I have made so far. And I would like you to give me your opinion, feedback about how to go about these videos and whether this way of uh, doing or talking to you is a good way, or I need to change it. Thank you very much. Appreciate you and appreciate you being with me today. And I hope to see you in other videos. Thank you.